Hey, it's Mike Brennan. We're doing another episode of Michigan Marijuana today. And I have my co-host with me, Dave Crable, former president of the Industrial Hemp Association of Michigan, Hemp for short. Welcome, Dave.
Welcome. Glad
Okay.
to be here.
Now we're going to be talking about hemp stuff today, so we decided to bring in the pro from Dover. That would be Casson Coleman. So, Dave, why don't you talk about what you all are going to talk about? Introduce Casson for those who haven't met her before. Take it away.
Excellent. Yeah, we're so fortunate. We talked Casson into joining the IHEP Michigan board, and Casson has been a fantastic resource when it comes to the befuddling world of Lansing. I can't get my head wrapped around Lansing at all. And back in the day, do you remember Brad Werfel? He was a PR consultant we hired. Brad was a great resource, but he would always caution. Now you can't if you get into lobbying, you have to do all this paperwork. And Mike, you know me a little bit. You know what? I don't like paperwork, so I am so happy that we have Casson to keep track of this stuff and to keep us on track. And Casson is active in the hemp industry. She grows here in Michigan and does a lot of testing. We're going to talk about testing a little bit today, I think, because that was one of the topics that came up. So thank you again, Casson, and let's dive into it. What in the world is Lansing up to, and what can we do to try and get their heads on straight?
Yeah, wow. Thanks, guys, for
That's a
inviting me.
small ask, right?
I appreciate getting to come. Yeah, so Lansing's doing a lot on hemp right now. There's actually pushes from both sides. And when I say from both sides, I mean pushing to make things easier for hemp farmers to do their work in the state, while simultaneously pushing to make it harder for hemp farmers to do things in the state. I think that's often how it is here in Michigan. At least it's how it's been for the last 6 years or so. And right now, what we're seeing is we have bills to repeal the Growers Act, which will get rid of an MDARD program and send things back to the USDA, like many other states in the nation, for the federal hemp program. While simultaneously, we have some very specific to Michigan requirements that will actually reduce the amount of hemp products that can be available in Michigan under the federal law. And even more so than will happen under the changes in federal law that go into effect in November of this year. So those things are definitely happening. The Both sets of bills are bipartisan, and they are moving with specific reasons from different constituent groups, right? So there's agricultural groups as well as the government who's like, hey, MDARD can't afford to maintain this program. Let's send it back to the federal government, right? Plus farmers also want to see that happen. So there's good momentum there. It's already made it through the Senate. The bills have been read in the House, and we're waiting for them to get through committee. So I'm excited to see that will happen. We've been working on it for about 4 years now, and if it happens this legislative session, that'll be a good thing for all farmers. On the flip side of that, we have bills that are in the Senate right now that have made it through there that are also being seen in the House. The House has slightly different versions of the bills. And in this case, it's trying to make it so that consumer products that contain hemp derivatives get to exist in their own Michigan-specific legal sphere with slightly tighter than federal requirements will go into effect in November. So the federal requirements don't have the same level of regulation that we will have here. There's no requirement for like hemp licensure, for instance, at the federal level. But there is in Michigan, as well as much more extensive requirements for testing, what kind of lab can do the testing, and I would say the broader impact here is specific to what kind of marketing, advertising, et cetera, that you can do for those products in the state of Michigan. Michigan is very adamant that these products cannot be even kind of enjoyed or liked by minors. I know there's a lot of conversation about, oh, for the children, but the way the law is actually written, it's for people under the age of 21, which I would say most people think that people in their late teens, early 20s probably are like things similar to people in their late 20s or 30s, for instance, right? So there's some interesting caveats there, and the way the new rules that the hearing is going to happen on this coming Thursday discuss in more detail, right? So in some cases, we're seeing parallel executive branch action within the administrative rules process while seeing legislative branch action with proposed new statutes going into bills. And these things are happening concurrently, and they're on the same path. So reducing visibility of cannabis, reducing marketing, increasing the amount of child provision controls around things, increasing the kinds of warnings that have to be provided, reducing the kinds of advertising on packaging as well as advertising in the wild that can occur. And those things we're all seeing, while all at the same time, we just finished the rescheduling hearing, which is parallel to hemp from the standpoint that if all cannabinoids that come from cannabis sativa, which is at the federal level is called marijuana, become no longer Schedule 1, it changes the game for everyone.
Yeah,
And that includes cannabinoids that come from hemp plants that are then concentrated and put into other products, right? So there's a lot that's happening there. Though that case just ended, right? It ended yesterday. I guess technically it ended 2 days ago, but the official date of ending was yesterday. And we should see the outcome of that in the next couple of weeks, and probably then an additional lawsuit. So there's a lot going on inside the government as we all march towards some kind of reduced prohibition on the plant. And really, it's reduced prohibition on the plant, unless you're in Michigan, in which case we should just be prepared for everybody being locked back up.
No, we don't want that.
No, but that's the bills are moving that direction, recriminalizing cannabinoids in the state of Michigan.
And let me clarify. You said next week Thursday, so that'd be the 23rd. Is that right? Okay.
9 a.m. on the 23rd at CRA headquarters. There is a public hearing on the final draft before it goes to JCAR.
Okay.
For
and
the new administrative rules.
It's open to the public. Anybody can show up, kind of thing.
Yep, open to the public. Anybody can show up. They also have a Zoom invitation so that you can show up remotely if you can't come in person. And they accept written comments if you are unable to attend in person or online.
Oh, okay.
I'm going to try and be there. And do I have to register in advance to speak, or?
They have speaker cards, and the hearing will stay open until all that want to speak have spoken. So the last hearing went for 6.5 hours.
Ooh. Bring a bag lunch there, Dave. So. Hey, one of the things I wanted to let me jump in real quick. One of the things that's sort of been percolating out there is the beverage industry is now getting into THC products in a big way, and so I was really doing my research this morning before we started, and obviously the hemp situation, whether or not what happens on November 12th, because I know it's like what 0.04 for the entire container, which really wouldn't do a hell of a lot for you, right? But that's focused on the hemp related products. Now, can they still extract THC related stuff from cannabis, not hemp? And would the beverage industry then be able to move forward with THC laced products from cannabis? That's the part that's a little gray right now than what he really understands,
Well, you can certainly do that in Michigan if you're a licensed operator and selling through a licensed retail establishment. Those products exist.
Depends on how much you're paying the government, Mike.
Yeah, there's a lot more than 0.4 milligrams in the beverages you can currently get in licensed establishments here in Michigan. I don't know that you could say the same thing about the beverages that you could get in Target or delivered to your home direct to consumer. Yeah, those products may or may not get to continue to exist.
Yeah, that's what I was thinking is if you start bringing in big money like the beverage industry, then they're going to bring in their lobbyists. They're going to put pressure on Congress. Things could change. I mean, right now, where do you think that bill stands? Is there going to be Still got, 5 months. So are we going to have modifications? Do you see changes coming because of all the pressure or what?
Yeah, there's definitely amendments that have been put out there at the federal level to change the law. The president, like every month or so, comes out and says the Congress needs to get its act together and fix the hemp issue, which is what you're talking about for beverages and other edible products, making it so that those products can still exist on the market. That's what he's talking about when he's saying that. There are currently 2 bills that would basically undo what's being done in November, and one of them pushes it out for 12 additional months to give us more time to figure out regs. The other pushes it out for 3 years. There's another that rescinds it completely, and then there's the last one that's the Wyden bill, which personally I really like. I got to work with the Wyden office to do this work, was to just regulate it like we do all other stuff, right? Like we do food and cosmetics and
Which is
dietary
what we've been
supplements.
asking for since 2018.
Yeah, exactly. So it would, create a new office of cannabis management and control at the FDA. So there would be a specialized group, and instead of trying to lump it in with drugs or dietary supplements. And I think whether any of these actually get to see a vote is a foregone conclusion. There's a lot of other potentially important stuff that's happening in Washington, D.C. right now. At least that's what the news tells you. But the amendments have been read in. They exist. The bills are on there. There's co-sponsors for most of them. And it's a bipartisan issue. It's not both parties agree and we should move forward, but members of both parties agree and perhaps we'll move forward.
Well, there's still a lot of conservative elements, particularly on the Republican side, that look at it as the devil's lettuce kind of stuff.
Oh, very much so, right? I mean, the
Yeah,
previous
so
Senate Majority Leader, who is still very ill right now, is very against this and wants to make sure that it doesn't happen. And it's complicated when you think about the fact that his state is one of the states that produces the most of these products in the nation, while all simultaneously saying that they shouldn't get to exist.
yeah,
Yeah.
well, that's politics. Don't get me started. It's like politicians are like babies. You need to change them all the time. So
So I think it's good. The traction that we're seeing is good, and I say the traction is good because prohibitionists are having to raise millions and millions and millions of dollars to lobby the other direction, and are coming out in force in states like Michigan, where they're trying to convince regulators that these products are really dangerous and we should do something about it. Even though the product has the same amount of danger it's had for the last 10 years, maybe even 30 years, probably not 1,000 years, okay? Because there's a lot of new consumption methods out there that may or may not be quite as safe as smoking a joint. And I think that says something about the momentum of where the industry is headed, both from just the standard cannabis side of things and where the hemp industry is headed. At the international level, we're seeing voluntary consensus standards that are clearly outlining things, like the World Health Organization, so that things can move forward. Medical is accepted in over half of the nations around the country now, including the United States. And products that are derived from hemp fall inside that bucket, right? Those products can now be in the United States sold to ACOs and cancer therapy clinics and reimbursed by the federal government. That had never happened before. I'm not seeing anything that's making it so those products won't get to exist, and so that momentum still looks good. I'm concerned that the current draft rules that are going to be in the hearing next Thursday will no longer allow those products to be made here in Michigan. And that just sets us one step further behind all of our peer states that have hemp programs here in the US. And I don't 100% understand why they want to do it that way. There's bipartisan support in the Senate to move forward with hemp consumer products. That bill is already passed through the Senate and it's in the House waiting for committee review. While simultaneously, the executive branch, CRA through administrative rules, is trying to say those products can no longer exist. I don't understand why they want to do that. And I think when we look at the prohibitionist movement and the kinds of things that they're saying, oh, well, we don't want kids to have access. Oh, we don't want to put any rules in place to help kids not have access. Oh, we're sick of seeing all this advertisement, but we don't want to put any rules in place to prevent the advertisement, right? Like, they continue to do things in response to constituent outcries that don't actually address the issue, but make law-abiding citizens have to do more work. And really at this point, it's become unreasonable. And so we went from what, 1,800 licensed farmers to less than 20?
Yeah.
More than 1,000 licensed processors to less than 200? I mean, that says right there that the program is not
Well,
working the way that
and
state is handling.
and we have product showing up in the gas stations from California or other states that we don't want here in the state. We don't want to sell to kids. We don't want to sell the high THC products. We want a fair, regulated hemp path. So, if we, I wish we could find that common ground.
The new hemp path, Dave, is only through licensed marijuana establishments. And I don't think that's what anybody intended.
No.
Yeah.
Hey,
But
are you,
that's where it is.
Cassie, are you also tracking what's happening on a federal level with those hearings in
Yeah.
DC? I know if for those that aren't, this is not broadcast on my more general business show. So just as a refresher, for medical marijuana, the DOJ, I don't know if it's actually gone through and been approved, but wanted to reschedule medical marijuana on a state by state basis from Schedule 1 to Schedule 3. And correct me if I'm wrong on any of this. And then I've kind of I wrote about it for a week or two, and then I've been focused on other things. Where do we stand now with those hearings in DC? Do you know?
Yeah, so those finished 2 days ago, and those were for the rescheduling of all cannabis from Schedule 1 to Schedule 3. The medical cannabis rescheduling already occurred. That happened back in April. It's already been rolled out. The Controlled Substances Act has already been updated and changed. And so far, the courts have thrown out, for lack of standing, all of the legal challenges to the reschedule. There's one more case that's pending, and we might see something about that here in the next couple of weeks. The hearings that just happened to do the full rescheduling, which was what Biden proposed under his administration, the current administration is continuing to push forward with that final rule, is rescheduling of everything from Schedule 1 to Schedule 3, noting that it has a defined medical use and it has less habitual habit forming items than things that are currently Schedule 2. So, Schedule 3 is still a drug classification, and there are a lot of other things that would need to have to happen, Mike. But if they come out of this hearing, which I'm very optimistic from, all things point to momentum for the industry coming out of these hearings. The prohibitionists who were present had an opportunity to cross-examine. The answers were consistent. The government was defending rescheduling for the first time in the history of the attempts to reschedule marijuana. And that level of acknowledgement that there is medical use for the plant now, therefore it should not be Schedule 1, and there is limited habit forming, therefore it should not be Schedule 2, was just repeated over and over and over again for those 2 weeks. Didn't matter what questions were asked. So I think we will see a positive outcome from that hearing. And then, of course, we will immediately see the prohibitionists who have been raising millions of dollars for the next court battle will sue the government, saying that the hearing was done in an inappropriate way and why. And that's really what we're looking at. It's possible, although unlikely, that will get done before the end of the year. If that happens, we may have more momentum as we move into lame duck, okay, so post-November activity, where people who have historically been against legalization efforts at the federal level will no longer feel like they need to stand on a soapbox because of Schedule 1, and will be able to finally acknowledge what they've all known in their states, at least 40 of the states, right, is that cannabis has medical use. We shouldn't be preventing patients and consumers from having access to something that shows very little harm when compared to other substances, right? I'm not going to say that there is no harm, just very little harm when in comparison. And that's what was acknowledged in these hearings over and over again. And can't get better than that when the government comes out and says, oh yeah, these products never should have been scheduled this way. It's kind of great, right? So
What's the danger of this only being pharmacies that can produce CBD products?
Yeah, it totally could be. Right now, the way it's written, they would have to again go through a final rule to change how the CSA has been written for medical cannabis programs. But for adult use products, this could be relegated to where, okay, you can have it, but it can only be pharmaceutical grade and you can only get it through pharmacies. That's not what the bills in the legislature look like. Almost exclusively the bills, which we have bills on from both parties, clearly indicate let the states decide, similar to how they currently decide for things like tobacco and alcohol in their states, how they want to regulate products within in their borders. So that would mean in Michigan, our program would then be federally legal, and we all have to keep marching to the drum set by the CRA, which is a very rigorous drumbeat.
Yeah. Yeah.
So, not optimistic that all cannabis, including recreational, will be Schedule 3 by the end of the year, but perhaps in 2027.
Yes, yes, and possibly by the end of this year.
I think
The
that's still kind
the
of a
hearing
long
is
shot.
done. The
Yeah,
hearing
go
is
ahead.
done, and then they're going to have to sue to prevent it from going forward, right?
Hmm.
And the courts could decide that they don't want to listen to it, and then they would have to appeal to the Supreme Court. If the Supreme Court says they don't want to hear it, then it's the law of the land. We don't know what the Supreme Court's going to do because they kind of are shooting from the hip right now. Uh, but we
You
believe
put
that
it nicely,
the
yes.
DC Circuit Court will probably, do what they've been doing on marijuana, which is find that the prohibitionists have no standing.
Yeah. Okay, well,
So
that'd be interesting, certainly. And of course, Michigan being one of the top states in the country for cannabis sales. I mean, we're still averaging over $3 billion a year. This year, it might be a little less than last year, but we're still in that 3 billion figure. So that have a big impact on the state, then, right?
For sure. And, our head of the CRA is now the executive chair of CANRA, which is an international cannabis regulators association. And when I look at that, I look at our financial information, this side. I mean, we have over 40,000 cannabis employees in the licensed market, not including caregivers, not including traditional market folks here in Michigan. When you think about all of that, we are the largest. We're the largest mass producer of this product. We produce more than even much larger states like California and Florida. And when we look at places like Texas, where we see the hemp products are out there, we're even bigger than Texas. And Texas is a massive, massive state. So I think there's a lot to be said about us being a leader, certainly a regional leader, as well as, I may chafe under the regulations from the CRA and constantly fight to make them more reasonable and more aligned with consumer safety outlooks than some of the other things that the agency is focused on. But the truth here is our regulations are more robust, they make more sense, they're more transparent, and the clarity of the regulations that are here in Michigan compared to basically all other states. When you read section 420, like, I don't know why they named it that, probably because it's cannabis, right? When you read section 420 of the administrative code, it's clear, it's concise, and that's not the way it is anywhere else, right? We are setting the standard for regulations, and you can kind of see that as other states come online, they're mimicking our program.
I don't want to speak for Brian Hanna, but I mean, I've addressed that very question to him several times. And he will say, look, they hired me to be the enforcement guy. If you want to change the regs, talk to the legislature. I mean, I'm not defending him, but that is his position. He's the sheriff, but he
yeah,
doesn't create the laws, right?
It's funny because he's literally rewriting the entire 420 administrative code right now,
Is
and
he?
we get one more opportunity to talk about whether or not we like how he's rewriting it on Thursday of next week. And the revisions are huge. 217 pages of revision,
Was not
right?
aware. Okay, so
Okay, we're not talking about like a change here and a change there. Complete sections removed, whole new sections added. Um, Other sections with tweaks to them, making them more robust and more specific. Some places where you would think, wow, why are they even thinking about that? Because he's thinking future tense. How can he do enforcement in a better way? what information does he need to be able to do enforcement in a better way? And they're writing it into the rules and making you provide the investigative tools as documents that you have to give to the agency, so that his guys don't have to like have that kind of surveillance, and they can get the information more quickly, so that enforcement and investigations can go faster. Like, that part is very clear with the way they've made the changes. There are some subtle changes to consumer safety requirements and a huge change to the industrial hemp section. When I say a huge change, guys, the section used to have 6 sections clearly outlining how hemp handler processors in the state could make products and sell products inside the state and also to licensed operators. Now, you can't do that any longer. You can't sell to anybody any longer. You can only process hemp if you're a medical cannabis license holder, right? Like, it's a radical change to hemp processing in the state of Michigan.
Yeah, and they don't differentiate fiber or grain at this point. Like Robin Pott had pointed out, because we've had Brian Hanna on, talk to him, and he says, "Oh, I'm not worried about fiber and grain or top CBD topicals. I'm not going to enforce those." Well, that should be in the rules somewhere. It should be visible, because it's not.
Yeah, it's definitely not. They point directly to the Industrial Hemp Research and Development Act, which clearly states you are not allowed to commercially market the products that you're making. Full stop. You are only allowed to sell to licensed hemp operators. That's it. You can't sell to anyone else. And medical licensed facilities. If those are the only 2 places that you're allowed to sell to, you're not selling to a consumer. That's how the current rule is written, in the draft state that we're all going to go to the hearing on the 23rd for. That's how the statute is currently written, right? So, they're interpreting the statute to say, hey, if you try to make a marketable product from industrial hemp that you've harvested, that's processing. And now processing, instead of being able to be done by any hemp handler processor, can only be done by a medical licensed operator. Do I think they did that on purpose? No. Is that how it's written? Yes.
Yeah, they just don't understand the market, really.
No, I don't think they understand the market, and I think also there's a focus on preventing activities that are not currently being performed by licensed hemp operators anyway, right?
Mm-hmm.
Like, they're focused on preventing guys in Florida from putting stuff in gas stations that can get sold to kids. Those guys aren't licensed in Michigan anyway. They don't care, right? They're not going to go away because farmers can't sell their crop here in Michigan.
It's kind of like gun laws. Okay, you can outlaw all the guns in the world, but there's still going to be hundreds of millions of guns here in America.
Oh, very much so. I love this. You can outlaw all guns in Lansing. Not that they have, but you could. But you can still have them in DeWitt.
Yeah.
Okay, right? So, like, it's like, I think about it with Chicago, right? You can't have guns in Chicago, but the entire surrounding state, you can buy guns like every 2 blocks or whatever.
Oh, I think there's a lot of guns in Chicago, but
yeah.
particularly on the south side.
The law says you're not supposed to have them. That doesn't mean they're not there. Which just kind of goes back to, we know prohibition doesn't work. A lot of law enforcement continues to think prohibition works. And
we need a strong business base, so that'll keep, there won't be a need for these guys to come in from outside.
Because the products will already exist and they will be so profitable that people will want to work inside the system. Of course, we have hampered the existing system. We've hampered it by making it cost so much to grow hemp here, by making it impossible to process and make these products here locally in Michigan. So, of course, we can't make them, not legally anyway. So people are going to be like, oh, consumers want that. You can't make it there. I will bring it from Indiana, because you can make it in Indiana and bring it here, which is honestly the craziest thing, since you can't sell them in Indiana, but you can make them there and import them or export them, right? So come on, guys.
Yeah.
Well, we're coming down to the end of the half hour. So any kind of final thoughts? And then also, Casson, if folks want to reach out to you, be sure to give that information, how they can do that.
Oh, yeah. Okay. My final thoughts on this is, everything that I just talked about is a public process that you can be involved in. You can talk to your legislator, you can talk to your executive branch leaders, you can come to public meetings, you can go to hearings. Not being present means you're not part of the conversation. The people who want this to happen don't want us to exist. We have to show up to defend ourselves. Please show up next Thursday. If you want to talk more about this, you can reach me. You can go to consultcasson.com. Right? I know, crazy. Consultcasson.com. Or you can reach out to me, direct via email, which is tlcoleman4@gmail.com.
And then once again, the hearing, give the specs on the whens, the wheres, the what room, that sort of thing.
Yeah, so it'll be at the Grand Avenue location of the Cannabis Regulatory Agency here in Lansing. It's at 9 a.m. on Thursday, July 23rd.
Yeah,
And we're hoping a Zoom. There'll be a Zoom link for those that want to watch, right?
Yep, there is a Zoom link, so it'll be publicly available. Last time we went to a hearing, they did not make a recording available. So if you guys care about something like that, be prepared to record the proceedings because it got fiery last time and they didn't make it available after the fact.